Thank you. Am I behind yet? As I was going through this morning, it reminded me of an episode of I Love Lucy in the Chocolate Factory, where the slides keep coming no matter what. I'm going to be talking about using disease surveillance systems, rumor surveillance, which ProMED does a lot of, but instead of for diseases, for rumors about vaccines. Just to remind us all, vaccines have been one of the great public health success stories, certainly of the 20th century, preventing maybe 2.5 million child deaths a year. Just as an example from Massachusetts, this is the introduction of Haemophilus influenza B vaccine, something that occurred during my career and virtually led to the elimination of that disease. But despite the successes of vaccines, vaccines are often challenged. There's increasing hesitancy about vaccine, mistrust of vaccines. Polio was on the cusp of eradication in Africa in the early 2000s, but a boycott in northern Nigeria led to the end of that eradication and the spread of polio from Nigeria to a number of neighboring countries throughout Africa and even around the world. And really the legacy of that is still with us. In 2011, 2012, polio is still very much with us, unfortunately. Another episode was the famous Andrew Wakefield study linking the measles, mumps, and rubella vaccine, now I'm ahead of my slides, to autism and other neurologic conditions. And again, this was published in 1998, and it wasn't retracted by Lancet for 12 years. And in the meantime, mistrust of polio vaccine grew and caused a situation, sorry, measles vaccine caused a situation where this past year in Europe there were over 26,000 cases of measles. So mistrust of vaccines leads to serious problems. And this was the genesis for a project called the Project to Monitor Public Confidence in Immunization Programs. It's led by Heidi Larson at the London School of Hygiene and Tropical Medicine. And these are its purposes. Initially, we want to monitor, and I'm going to focus just on the upper left-hand 3 circles here, the automated data collection system, the manual entry of that data into a database, and then the rest of the project will take that information. Ooh, I'm going forward much too fast here. Can I go backwards? And lead to a situation where we can hopefully respond to rumors before they become an issue, before they become a public confidence issue. Now, is this going to keep going? And this is a little bit more detail on the process. Essentially, there's a collaboration with HealthMap where data is gathered from news aggregators. We're using search terms, which are continuously being refined through HealthMap. It derives an automated feed. These kind of emails go to our analyst staff several times a day. The analysts, one of whom, Melissa Cumming, is in the audience today, read each of these reports, go to the actual news story, and look at the report and say, what vaccine does this involve? What kind of a threat is this? Is this a serious threat, not so serious threat? Is it positive information about vaccines? Where is it occurring? And enter all of this information into a database. This is what the database screen looks like. It allows us to classify the types of vaccine rumors. Are they about adverse events? Are they religious, political, programmatic? How are they about contamination or other issues around vaccines? Enter all of this information into a database. So in a little over a year and a half, we've received and curated over 20,000 reports, and really throughout the world. Now, we haven't had time, we haven't completely analyzed these data, but I'm just going to give you a few tidbits about the kinds of data so we can look at the kinds of vaccine and vaccine-preventable diseases that are involved in these reports. And you can see that measles is one of the leading issues about negative reports. And we can classify these by the country where they're occurring. So you can see that, for example, in India, Pakistan, and Nigeria, polio continues to be a concern. In other parts of the world, measles and HPV are some of the major concerns. And we can start to look at that and examine that. We can also see the effects of certain events. This was about a polio-linked, quote-unquote, death in India, and you can see that how news reports around that event spiked. So in summary, vaccines have been a real success story, but they're threatened. And we now have the capacity to monitor rumors about vaccine in real time, and hopefully with understanding the public perceptions about vaccines, we will be able to mount a response to that. So thank you.